Hello, welcome. I'm going to do a quick report on intensive care admissions. It's quite topical in the news at the moment. It's interesting to compare the number of admissions we're seeing now versus the number of admissions back in March and April time, and also perhaps compared to the number of flu admissions that we see on a yearly basis. So the data is produced by ICNARC, and if you do a search for ICNARC reports, it'll take you straight to the report itself. This is a PDF document, and I'll walk you through some pertinent sections. I'll just zoom in so it's clearer on your screen. It's about 20 pages long, so I won't go through in detail, but I will pick out bits of interest. So they've split the report into two time periods, patients admitted up to the 31st of August and patients admitted from the 1st of September onwards. So the map can show you clearly that the hotspot originally was in London in the first wave, so to speak, followed by the Midlands, the Northwest and Northeast. This time around, since 1st of September, we're seeing the Northwest, the Northeast, followed by Midlands and London. So I've taken these numbers from each of the last three reports. They've done three of them now since the 1st of September. They're published on a Friday afternoon, and I've put them into a spreadsheet. So the number of admissions is simply typed in, copied from the map. That allows me to calculate the number of weekly admissions, and I get those for weeks 2 and 3. Week 1 was obviously a starting point, and I've also calculated the number of admissions per 1 million people in the population, which allows us to compare across the regions easily. So when we do this, it's very easy to see that the regions receiving the most patients in the last week are the Northeast and the Northwest. They're both receiving an equal number of patients per million in the population. And we can also calculate growth rates, and we can see that there's a number of areas where there's a daily growth rate of around about 10% or higher, which is clearly not a good thing, and that's a daily growth rate. That's not a weekly one. I've converted it from a weekly growth rate. So if we go back to the report, so let's scroll down a bit so we can see the peak of admissions originally was at the start of April. We knew that already. We can see that there is a resurgence through September and into October. There's a lag on the data, so these later days are lacking data. So we'll scroll down yet further through the report, and we'll have a quick look at the age of admission. So it's widely thought that people worst suffering from COVID are in their 70s or 80s. If you look in intensive care, what you'll find is that the mean age is about 59 years old. So the average age, as most people would consider it. The median, 50% of people are under the age of 61, 50% are over the age of 61. And the interquartile range tells you that 25% of the patients are under the age of 49, that 75% of patients are under the age of 70, or you could also say that 25% of the patients are over the age of 70. And that's possibly younger than most people will think. So the female to male split is about 30% females to 70% males. In this report, I'm not going to go into the ethnicity, deprivation or body mass index. We all know the risk factors associated with those, and they go into a great amount of detail in this report to show that. So I'm just skipping through those sections now, which compare to the population average for those various criteria. So they have a flowchart, number of patients logged, number of patients with their first 24 hours of data recorded, patients discharged, patients that have died. But I'm going to skip straight to the actual table with the values themselves in. So if we look on the right hand side, we got the patients admitted up to the 31st of August. There were 10,800 of them in total. The number of them that were discharged, 60% of them survived intensive care and then may have gone into a normal hospital ward or may have gone back home. 39% of them went on to die in ICU, and there were very few of them that haven't had their full report submitted now because they were admitted up to the 31st of August. So remember these figures, 10,800 people were admitted and 39% of them are dying. That was 4,200 people. And let's do a quick look at the flu report. So just to show you how you find these, you can simply Google annual flu reports. It will take you to a government website and Public Health England annual reports. We're going to dive straight into 2017-2018, which many of us will know was the worst year in about 45 years. So it's a good one to look at. And we're going to skip to the section which is US ISS mandatory scheme. Now, these are the people that track patients in intensive care who are being treated for influenza. There were a total of 3,400 admissions for this particular flu season. It lasts for 6 months, a flu season. And of those, 372 people went on to die. So this was for the whole of the UK. They do breakdowns for smaller areas, England, for example. And this was the worst year in 45 years. We can see on the graph above actually the number of admissions here that it was significantly higher in 2017-2018 season as it was in prior years. Now I've taken all of that data and put it into a Google sheet. It's like Excel, but it's just an online version of it. So here are the actual numbers. The number of admissions in the UK ranges from about 1,000 to 3,000 patients per year, effectively. The number of deaths, which is about 100 to 300 per year. The percentage of patients that are dying is about 10% on average. And I've also put the COVID figures here. There were the 10,700 people that I mentioned who had been admitted, of which 4,200 died. That's a 40% mortality rate. So if we show this in a graph, we've got two colours, the admissions in blue for the 5 years, 2015, 16, 17, 18 and 19. And then on the right hand side, we got the COVID stats, which are for the 6 months from the start of the pandemic onwards, up to the end of September basically, and the deaths are in orange. So looking at these separately, the admissions we can see year on year does fluctuate a bit for the flu, but it generally doesn't go above 3,000. That was where it was in 2017-2018, worst year in 45 years. And then we got the COVID admissions, which are on the right hand side, which are about 3 times the size of the flu in 2017-2018. And we also have a graph here which is a total number of deaths per year in intensive care for the flu, which is 2015, 16, 17, 18 and 19 are the small bars, and then we've got the number of COVID deaths in intensive care, which are mainly for March, April, May time of this year. We can clearly see how that dwarfs all of the statistics for the flu deaths in intensive care. And just imagine working in there and seeing how different it must be for COVID. People really should stop comparing COVID to the flu. It really isn't. So let me move on back to the ICNARC report. And we will be talking about the length of time in care, the percentage of patients that are discharged versus the number of patients who die, and whether they end up on a respirator. So I've put all of this data into another sheet in Google Sheets. So the admission data we've already been through. It's basically a 59, 60-year-old on average, and we know that for 25% of patients are under the age of 47, maybe 49 in recent weeks. 75% of our patients are under the age of 70. It's still a 30% female to 70% male distribution. The percentage of patients who were discharged or died or still receiving care in its raw form is here. Those obviously add up to 100%. But I've calculated of the known outcomes, i.e. people that have either died or gone on to be discharged, what percentage that makes of the patients for which we know the outcome. And we can see that over the last 3 weeks, the number of patients, percentage of patients being discharged alive is falling. The percentage of patients who are dying is increasing. That's partly because the stats take a while to settle down, because this is a new report and it takes longer for people to die in intensive care than it does to be discharged alive on average. So that number will increase week on week for a few weeks and then settle on a final value, which maybe around about 30%. I don't know what that figure will be, but we will see. We see the duration that people surviving tend to stay in intensive care. That's 5 days versus the people who go on to die, which is also 5 days. But what's different between them is the interquartile range. So we can see at the upper end of the range, 25% of patients who survive will be in intensive care for 8 days or longer, whereas 25% of the patients that die are in intensive care for 12 days or longer in the current report. Now, those ranges are also increasing because this has only been done for a few weeks, and again, it will take a while for the numbers to settle down. Previously, it was 16 days for people who who die, and 28 days was the upper bound for people who go on to survive. 25% of people are in for 28 days or longer. And the other interesting stat is previously the number of patients on a ventilator was about 72%. Now the number of patients on ventilators in the recent reports is growing with each week. And again, we will have to see where that settles, but that could easily get up into the high 30s or the 40s even. So we'll see where that goes. The quick takeaways are that the admissions are rising rapidly. Some places are seeing an increase, 10% day on day. The hotspots are in the northeast and the northwest. We're hearing about that on the news, and they're worried about capacity being breached in about a week or 2 weeks' time with the current growth rates. And we also saw my comparison of COVID-19 versus flu for the last 5 years, including 2017, 2018, which people like to refer to as a typical year of flu. And it's really not the same disease. You should stop saying that. So hopefully you enjoyed the video. I would appreciate any likes. If you like the videos and want to see more, please subscribe. That's all from me. Hopefully see you again. Bye.